Yeah, you have been doing these programs regularly, Isha?
Since a very long time.
Okay. Mhm.
Yes. I guess since last year.
Okay. So all are related to one kidney or when you cover our other disease also.
So mostly, like what all I have done, Doctor, we are live now.
Yeah.
Hello, good evening. I am Isha Thakur and I welcome you to LiveDate's YouTube channel for another live session. Today, in this session, we have the privilege to host Dr. Swarnalatha Guditi. She is a MD, DM, FISN, FISOT, FRCP from London. She is working as an additional professor and as the unit head, Department of Nephrology at NIMS, Hyderabad. She is also Hyderabad head, Jeevandan Disease Donor Transplantation Program appointed in Government of Telangana. She has achieved the Best Paper Award in the National Conference of Nephrology and many others have also contributed to her treasure. She has even received a travel grant from the Best Paper in International Conference at Asia Pacific Congress Nephrology, South Korea in 2010, the Transport Society at Germany in 2012, and at the World Congress of Nephrology 2013. She is the Associate Editor of Postgraduate Nephrology Book 2011, Hemodialysis Manual 2017, and Manual for Transplant Coordinators. Along with that, she is also part of various publications as reviewer including Hemodialysis International, Indian Journal of Medical Research, Indian Journal of Nephrology, Indian Journal of Transplantation, Saudi Arabia Journal of Kidney Diseases and Transplantation. She has contributed a lot of publications, 70 research publications in various national and international journals in the field of CKD, renal transplantation, peritoneal dialysis and hemodialysis. With all of her experience and expertise, she is going to explain one of the most important and concerning topics nowadays among the patients, that is, debunking myths and facts about kidney transplantation, and will also answer all the related queries. Welcome, Dr. Swarnalatha, and thank you for taking our time for this session today.
Yeah, thank you, Isha. Thank you very much. And as has been introduced, I'm Dr. Swarnalatha. I'm the nephrologist at Nizam's Medical Sciences and the head of the Jeevandan program. So I would be today talking about debunking the myths of organ transplantation. So before I proceed, let me first share my slides. Yeah, are you able to see my slides?
Yes, doctor.
Yeah.
Yes.
Yeah, is it in slide mode and it's moving?
No, you have to do it in the slide mode.
Yeah, is it visible now?
Yeah, doctor, it's visible, but not in the slide mode.
Yeah, let me try again then. Yeah, is it now visible?
Yes, doctor.
Okay. Okay, thank you, Isha, and sorry for the inconvenience. So today I'll be talking on the debunking the myths and facts about the kidney transplantation. I'm not going to move my slide. Just excuse me for that. Now, is it moving slides?
Yes.
Okay. So, as you all know, the patients with end-stage renal disease, the kidney is not functioning and they have to be on renal replacement therapy. And we have various modalities of renal replacement therapy. It can be dialysis. Dialysis can be, again, the peritoneal dialysis or the hemodialysis. And the second, the best modality of renal replacement therapy is the renal transplantation. So renal transplantation is said to be the best modality. But why it is so? As you know, the kidney transplantation, it replaces the entire kidney function. In dialysis, what happens is it's only 10 to 20% of the kidney function is being replaced. And kidney has a lot of other functions apart from the filtration. It produces the vitamin D, which helps in the synthesis of the maturation of the final stage of synthesis of vitamin D and bone strengthening. It also produces several other hormones like erythropoietin. Erythropoietin, again, it helps in the synthesis of hemoglobin, which is very important. So all these functions are not replaced by the hemodialysis. So kidney transplantation, we are trying to replace the other main functions of the kidney apart from the simple filtration and the fluid balance. So that's why the patients on kidney transplantation, they have a better, good quality of life. They have a better survival rates when compared to the hemodialysis. And if you look at the cost, even the cost is much lesser with kidney transplantation. In hemodialysis, patient has to undergo dialysis for lifelong, and every dialysis costs somewhere between 2,000 to 5,000. For transplantation, it's only the initial transplantation procedure which costs. Subsequently, the immunosuppressive medication can be reduced to minimal, though they have to be on drugs for lifelong. So the cost is also much less when compared to the hemodialysis or the peritoneal dialysis. What is the burden of the kidney disease? As you can see, globally, every 14 minutes, someone is added to the list of kidney transplantation, and 13 people die each day while on waiting for the kidney transplantation. And if you look at the India, about 151 to 200 per million populations, they require transplantation. And around 2 lakhs people, they add into the list of kidney transplantation every year totally. However, if you look at what are the transplantation happening in India, only around 7,500 kidney transplantation happen. There's a huge gap between the requirement and what the transplantations being happening in India. So this is again because a lot of myths myths about the kidney donation and the transplantation procedure. So we are here to clarify all your myths and to have a thorough knowledge of kidney transplantation so that we can undergo the procedure with confidence and enjoy the good quality of life. So these are the few questions which a patient, while patient is being prepared for kidney transplantation, or a patient is individual is being asked to donate the kidney. So these are the queries or the apprehensions which an individual have. So when individual is asked to donate the kidney, so he has first thing which comes to his mind is whether he would be a perfect match to his recipient or the loved ones, or whether he has to undergo a procedure which is dangerous to his life, whether he need to use the drugs for the lifelong after the procedure, whether he can have a normal quality of life, how about the sexual life after donating a kidney, whether he can undergo the normal reproductive life with having kids, like if can is a male, if can the father a child, if it's a female, he can go through a process of pregnancy and can deliver a normal child. What about the habits like the smoking and alcohol? Do he have to withdraw all this lifestyle? How about the long-term survival? These are the few questions which comes to a donor mind. And how about the patient who has to undergo transplantation? So again, he has a lot of queries in that mind when we counsel the patient, ESRD patient, and we ask them to undergo transplantation. When the patient feels that he's on dialysis, why not he continue to be in dialysis? Or whether he need to be on dialysis for some time before he has to undergo transplantation, whether he would be eligible for kidney transplantation at all, whether his age would permit him to undergo transplantation, or if at all he is ready for transplantation, would he get a perfect match for as a donor? And what about the surgery, whether it's whether he can overcome the surgery, is it complicated? So all these questions would be coming to his mind. And after transplantation, even if this surgery is successful, whether he has to use medications, and what are these medications, and how long he need to have these medications, and how about his quality of life, whether can he undergo the normal reproductive the life with having a child, and then all those the pregnancies and then childbirth normally, whether he has to change his lifestyle in terms of the habits like smoking and alcohol, and again, would he have a normal life expectancy with a normal quality of life. So let us address these one by one. So let us now first initially address the myths related to a kidney donation. So as I said, if a living donor is not a direct match, so most of the time what happens, if we look for a living donor which is within the close family members, the parents, the siblings, or the children. So first of all, we look for the ABO compatibility. It should be ABO matching. Second is the HLA matching. There should be some, there is what you call the matching should be there for a successful kidney transplantation. So we look for the basic these things. And if there is no ABO compatible matching in the family members, you don't have to worry, because there are other options available like the paired kidney donation. So if a family one is not suitable to their own recipient, and the family two is not a donor in the family two is not suitable to his own recipient, then we can have a exchange of the pairs. Pair A can donate to pair B, and pair B can donate to the recipient A. So that is also possible. So donating kidney is a dangerous procedure. That's often a myth. Though it is a complex procedure, it is not dangerous. It is where we have expert group of doctors who does the surgery with a very little complication, or in a very safe procedure, in a safe way. So usually the donor have to be on hospital within few days, and after that he gets discharged, and he has to take rest for only few weeks, and subsequently the quality of life or the complications or whatever is there is as similar to that of a normal individual. So it's just a simple procedure. They don't have to have any apprehension about the surgical procedure. We have a lot of expertise in this. We have various procedures also evolved, like laparoscopic and robotic surgery, and with little complication, and these procedures have the safest procedure. The living kidney donors have to take medications for lifelong. This is again a major myth. It's a big no. So usually donors do not have to take any medications. It's only during the surgery, 2 to 3 days following the surgery, because of the pain or for the strength, they have to take few of the antibiotics or the painkillers or the B complexes. Subsequently, they do not require any of the medication. It is the recipient who requires the anti-rejection therapy. It is not the donor. They can be as healthy as the normal individuals. Donating kidney reduces the donor life expectancy. This is what a donor thinks about, but it is again a big no. There is no compromise in the life expectancy. They will live the life whatever they have been, without donating a kidney, they are expected to live. So there is no reduction in the life expectancy by donating a kidney. Basically, a doctor try to subject the prospective donor to a lot of the investigations, particularly with respect to whether he is fit to donate, and second, whether donating kidney would affect his life subsequently after donation. If these two are cleared, only then doctor will encourage you to donate the organ. So after this, if patient is quite healthy and if it is fit to donate, and if patient declares that he will not have any of the issues in the life after donating kidney, so he can safely donate the kidney. Living kidney donor won't live a healthy life after the donation, because he'll be having only one kidney. This is again a myth, because the other kidney tries to overcome the function of the kidney which has been donated, and there is no compromise in the quality of the life. They'll have a normal life as has been expected without donating a kidney. But however, they need to take certain precautions, like they need to have a healthy lifestyle in terms of the exercising and healthy dietary pattern. Living kidney donation can harm the donor's sex life. This is again a myth, and usually while we are counseling the donors, they don't come out of these basic, sensitive questions. So I mean, it is quite normal. So we do expect that, and then it is we try to counsel the family members that there is no problem with their sexual life. They can actually have a normal sexual life, but however, they should be only restrain themselves during a peri-operative procedure within a week or two. Surgery will affect the donor's ability to have a child, whether it's a male or a female. Male can father a child, and female can go through the process of the conception and the pregnancy normally. But however, once they have donated the kidney, it is very important for them to have a regular checkups, because they can, a female particularly when is going through the process of pregnancy, there is a possibility that they can get a hypertension or the pregnancy related complications. So it is very important for them to have a regular checkups during their pregnancy, and to plan the pregnancy at least 6 months after the surgery. So there's a myth that they can actually have a normal, the lifestyle, something like, the smoking and alcohol, which usually we try to, avoid, in even in a normal individuals, irrespective of whether they have donated kidney or not. So definitely, if you have donated kidney, unhealthy.
Sorry for the inconvenience to our viewers. Doctor is facing some network issues, so she'll be back in a moment. So till then, let's just wait for her.
Yeah, Isha, am I audible? There
Yes,
was some
doctor.
problem with my
Yes.
network. So shall I proceed with my presentation?
Yes.
Yeah, is my presentation visible?
Mm, it's not visible, doctor.
Yeah, let me upload again.
Yeah.
Yeah, is it visible?
Yeah. Yes.
I'm sorry, there was some problem with my networking, so suddenly it got cut. So I have to reconnect it again. Okay. Okay. So let us move on to the myths associated with the kidney transplant recipient. So again, so the recipient, there are a lot of myths associated with the kidney transplantation among the kidney recipients. The recipients, do they have any option to receive a live donor? Would they have a kidney, perfect match? So again, as I said, we look for the IBO and compatibility. The O is a universal donor, so they can donate to blood group A, blood group B, and AB. AB is a universal recipient. They can receive kidney from the A, O, and B. B can donate to only B and A can donate to only A. So this is about the ABO compatibility. So again, coming to the recipients, so usually though AB is a universal recipient, they can't donate to either A or B, they can donate to only AB. And again, coming to O can receive only with O cannot receive from the A and B. So so also the A cannot donate to B and B cannot donate to A. So this is about the ABO compatibility. But however, now with the better medications available, so there is an option called as ABO incompatibility. But however, patient has to undergo a different protocol, immunosuppression protocol, and there are certain risks associated with it. And what are the other options? Other options are, as I said, kidney pair donation. It can be two-way or it can be multiple way. As I said, when the donor is not matching to their recipient, they can actually give to their other recipient, and the donor too can give to the recipient one. They can literally exchange their kidney. This is called as a pair kidney donation. It can happen within the two pairs, or it can also happen with the multiple pairs. Like donor with one can give to recipient two, donor two can give to recipient three, and donor three can give to either and recipient four, or it can close the chain by donating to a recipient one. This is what is called as a pair kidney donation. This is happening in the few centers in India. So what are the other options available? So apart from what I said is living donation, ABO compatible, ABO incompatible, and paired kidney donation. Now we have the other options called as deceased donor transplantation program, or donation after their brain death. So we have a structured program in our state called the Jivan Dan. So it is a government program, and it is a centralized. We have a centralized registry, and whenever we have a donation in the state, based upon the donor blood group or the age, we look for the recipients, and then we try to allocate the organs. So every state have their own organs. The organ donation program called as a SOTO. This is a state organization for the organ and tissue transplantation. And then we have a ROTO called as a regional organ transplantation organization. And then at a national level, we have a NOTO, that is called as a National Organ and Tissue Transplantation Organizations. We have a networking across all the SOTOs, NOTOs, and the NOTO. So if you don't have the live options available, you can enlist yourself in the deceased donor transplantation program. So each individual donor, the brain dead donor, can donate at least 50 to 70 organs in transplantation. And one of the commonest organ donation being the kidney, followed by the liver, and then we have the heart and lung also being donated, and then transplantation under this deceased donor transplantation program. So if you don't have any match, please enroll yourself in the deceased donor transplantation program. In our state, it's called as Jivan Dan, so you can enroll yourself in the Jivan Dan program. So there's again a myths associated with the age. Only the younger people will be able to get the kidney transplantation. It is not related to the age. Any age group can have a transplantation done. However, if your age is advancing, you have other comorbidities like hypertension, diabetes, coronary disease. So it's your responsibility to check whether you have these diseases, whether that would, compromise you from taking the kidney transplantation. So you have to be thoroughly investigated immunologically, physiologically, and of course psychologically also before you are taken up for the transplantation. If declared not eligible, a recipient will never be eligible to take the transplantation again. So this is again a myth because there are certain relative contraindication. When the patient is being considered for transplantation, there are certain situations which make a patient not eligible for transplantation that for that particular time, because patient might be having infection or whatever the donor is available that may not be matching, or patient might cardiac condition will be weak. So after dialysis or after attending whatever is the issue, like for example, coronary disease, we can go for a stenting. Subsequently, patient might get failed or not eligible, so you don't have to be disheartened. You please try to identify what is the cause and try to correct those things, and you can be re-evaluated with different criteria, or subsequent. You can also go for a different team who would actually may consider the high risk for transplantation as well. So to be recipient, you need to be on dialysis for at least few years. It's again a myth. You can be taken up for transplantation immediately once you go into a stage of end-stage renal disease. Once you reach an end-stage renal disease, is the time where you need a renal replacement therapy, either in the form of dialysis or the transplantation. If you have a live donor available within your family, you can actually go for what you call as a preemptive transplantation without dialysis being done. But however, if you don't have a live-related transplantation, you can actually enlist yourself with the deceased donor. But in the deceased donor, we have a huge waiting list. In that case, we need to wait on dialysis for your kidney to be allocated to you. And on average in India, I think it is 2 to 3 years, the waiting time on the deceased donor. So only in those situations, you need to be on dialysis before you are considered for the transplantation. So after a kidney transplant, all kidney medication have to be stopped. So patients on dialysis, they have to be on, on medications, right? From antihypertensives, then drugs for your hemoglobin, drugs for your vitamin D and whatnot. So many medications would be there. So there's a myth that once you get transplantation done, you're, you don't have to be on medications anymore. But you probably your pill burden will come down with respect to antihypertensive, diuretics, or vitamin D or other supplementation. But however, you need to be on immunosuppressive medication. As you know, the kidney is coming from another body, and your body can reject that kidney. To prevent that rejection, you need to be on an immunosuppressants. And mind you, these immunosuppressant drugs may be harmful to you, but that's the reason why you need to consult your doctor regularly. They have to be taken appropriately in the right dosage, in the right time, and you cannot withdraw with these drugs as per your choices, or we cannot increase the medications. This has to be strictly monitored by your doctor. So it has to be under supervision. So transplanted kidney will not last long. So however, though we have got the transplantation done, we cannot have a normal, life of like 30 to 40 years. Each kidney has their own lifespan. So on an average, live kidney will live for about 15 to 20 years, and deceased donor, the lifespan is about 15 years. But again, you need to be careful. You need to have proper medication. You need to have proper regular follow with your doctor. You need to have proper diet, and you need to properly take care of yourself for this lifespan. So subsequently, you're likely to have the rejections in between, or some complications. That's the reason why you need to be regular follow with your doctor. So kidney transplant recipient cannot have a healthy sexual life. As again, I said, and with the donor, the recipient also have these myths. Particularly when patients are put on hemodialysis and patient has this uremia, so their reproductive life is compromised. Their fertility comes down, the libido comes down because of various uremic factors and then the hormonal factors. When the patients undergo transplantation, all these things are overcome. The uremic amylo is comes down. The new neurohormonal axis, it normalizes. They have a normal behavioral pattern, and their fertility comes back to normal. And that's the reason why they can have a normal sexual life, but they need to have certain precautions and the healthy safety measures. And as their the reproductive life comes back to normal, the sexual behavior comes back to normal, and they have the fertility comes back to normal, there's a high chance that they will have a normal what you call as a childbirth. Whether it's a male or a female, the male can have they can father a child, and female can have a normal pregnancies and then deliveries as well. But however, before they go plan for a pregnancy, I mean, it is very important for all these patients, particularly in their reproductive, when they're undergoing transplantation in their reproductive, active reproductive life, it's very important for them to be counseled regarding all these things. And all the pregnancies should be planned. And particularly when the kidney function is quite normal, and at least there is 1 year post-transplant period, because there's a time where that patients are on minimal immunosuppressive medications, and their gland function is quite normal, and they do not have any abnormalities like proteinuria. And before planning for pregnancies, as I said, they are on immunosuppressive medications. These immunosuppressive medication could have some teratogenic effect on the fetus. So it's very important for them to change these medications when they are planning for pregnancy, and have a proper regular follow-up during the pregnancy as well. So these are certain myths. So ultimately, what I mean to say is it a good idea to undergo transplantation? That's the main, the myth which is compromising of ESRD patients to take up the transplantation. But I just want to ensure that it is very safe procedure. So most of the time when a patient comes to, they say, why should I undergo transplantation? I'm happy on dialysis. So as I said, dialysis will only take up 10 to 20% of the kidney function. He cannot regain all other functions like the vitamin D synthesis, erythropoietin synthesis, and good quality of life. The quality of life is always better in a transplantation. So it's very important for you to consider transplantation whenever it is possible. The other thing is, patient says, I don't think I'm a candidate for transplantation. So this is what is general behavior. But mind you, please consult your doctor. Let your doctor see you, evaluate you, and test you whether you are a candidate for transplantation. And of course, the quality of life is definitely going to be good in transplantation. And again, the patient thinks that they're too old to undergo transplantation. When it's not so. So particularly when elderly in the family, they get affected and they are depending on their kids to donate. In such cases, they don't think like they are the candidate for transplantation. They feel that they can't take the organ from their own kids, who have a very long way to go in their life. In that case, don't worry. We now have an external criteria donor, particularly deceased donor. They can have a matched, the kidney donor. So now whatever life they are trying to achieve through transplantation is definitely going to have a good quality of life, and it's worth considering transplantation irrespective of the age. So of course, the transplantation, the procedure has been evolved over a period of time, and they are very safe, and the very expert team have come up, and various innovative surgeries have come up, like the laparoscopic surgery and the robotic surgery. So whatever myth the patient had that I'm afraid of surgeries and what are my chances of successful transplantation, so it's you just come out of those myths. Transplantation is very safe, and it's very expertise. The expertise is there for this transplant procedure, and in terms of outcomes also, has been very successful transplantation. You see above 90% survival rates within 1 year, and even in the 3 to 5 years, the 80 plus percentage survival rates are there. And we have our own patient who is surviving for 40 years after transplantation. He got transplanted somewhere in 80s, and now he's still surviving. So we have seen a survival rate of more than 40 years. So it's definitely worth considering the transplantation. So whatever doubts you have, you can approach your doctor to understand it better, so that you can take up the transplantation with confidence and enjoy whatever is the benefit of organ transplantation with good quality of life. To summarize, kidney transplantation can be a new hope of life for end-stage disease patients. There's a lot of myths associated with kidney transplantation. Bursting the myth and understanding the realities might help patients consider kidney transplantation as a treatment option. Discuss with your family members and loved ones before considering transplantation, because when people may come forward for the organ donation, and both of as a donor and an organ recipients, both of you have to understand the what is the procedure and what are the lifestyle modification you need to undergo post transplantation, both the donor and as the recipient, and discuss with the doctor can help clear whatever doubts and understanding the kidney transplantation better. Thank you very much. for the opportunity. If there are any questions, I'm ready to take.
Thank you so much, Doctor, for providing us with such important insights over this particular problem and topic. So now we'll take few questions from our viewers. So, starting from the first question, Doctor, a little important also, why kidney transplant is better than dialysis?
Yeah, as I said, dialysis, we are only trying to remove the metabolic waste products and some amount of fluid through the filtration, through the artificial way of filtration. So it cannot replace the other kidney functions. Kidney has other functions as well apart from the filtration. As I said, it has got a function of vitamin D synthesis, the erythropoietin, the hypertension management. So these, the functions cannot be replaced while on hemodialysis. For to get these functions, we need to have a kidney transplantation. So definitely the quality of life is good with transplantation when compared to the dialysis.
Moving on to another question, what are the complications of kidney transplantation?
Yeah, basically, after the kidney transplantation, the two most important points to remember is because patient has to be on medications that is called as the immunosuppressive medications. These medications have to be used for lifelong because kidney is a foreign body. The body recognizes that kidney as a foreign body and tries to reject that kidney. So prevent that rejection, patients have to be put on immunosuppressive medications. Once patients are on immunosuppressive medications, they are trying to suppress the immunity. So body's immunity is very important for to overcome the infections. So I mean, as an individual, we see like we are affected with the infections. Now we are fighting with the COVID. So we can have any infection like diarrhea or the pulmonary respiratory infections or any other infections. So immunity is a natural mechanism to fight that infections. So once patients are put on immunosuppressive medications, the immunity comes down. So there is a susceptibility of that particular individual to get those infections that's called as opportunistic infections, which we commonly see and which we don't get affected with those organisms. But because these patients are immunocompromised, they can get these infections called as opportunistic infections. And these are quite, uncommon, these are affected in an unusual way. So that's the main complication we see. That's what immunosuppressant has to be used appropriately in appropriate dosage. And the other side is if we don't give these immunosuppressive medications, patients can get rejection and kidney can be they can lose the graft. So these are the two side effects which has to be carefully balanced, and then something like a balancing on a tight rope. So we can balance better. Of course, the quality of life will be good and they can have a maximum benefit with the maximum survival rates.
So, doctor, if you talk about the cost involved, so what is the average cost for kidney transplantation?
Okay, so average cost, mostly the cost we can divide into two categories. One is the cost of the transplantation procedure, and second is the cost after transplantation, where patients have to be they have to use the medications, immunosuppressive medications. So usually the cost of the transplantation, it comes as a package, basically transplant workup and then the immediate the surgery and the immediate post-op the care. So it varies from a hospital to hospital. We come from a government hospital, public sector. Everything is free of cost, and we have a insurance for that. That is called as Arogyashi government insurance. I believe at a national level we have this central government insurance, Ayushman Bharat. So in our Telangana we have a Arogyashi. The package is around 2.5 lakhs, 2.5 to 3.5 lakhs. But however, in a corporate hospital, it goes somewhere between 5 lakhs to 10 lakhs for a kidney transplantation. And subsequently, for the medications, usually at the beginning, because in initial 6 months is a crucial, because that's the time the chances of rejections are very high. So patients have to be on high doses of for the medication. So that's why the cost in initial months will be high. That somewhere varies from 5,000 to around 7,000. Subsequently, what we do is we try to gradually taper the immunosuppression. And patient after 1 year will be on minimal dosage of immunosuppression. So that cost also comes down. It will be somewhere around 3,000 to 5,000. So this has to be used for the lifelong. And we can actually maintain, with this cost. But however, there are complications like rejection or infection, what I said. So the cost may go up during those periods.
Okay. So another question we have from our viewer, doctor, then that can a diabetic patient donate his kidney to a normal person?
Yeah. So when we are evaluating a patient as a donor, we try to subject that person to a list of investigations, including the hypertension, diabetes, the kidney function, the lipid profile, and all others. Whether patient is having a proteinuria, the cardiac function. So all the basic tests have to be a patient has to go through all these tests. So diabetes is one of the contraindication because once there's a diabetes can affect the kidneys. So once patient is donating, the individual is donating the kidney, so he can have a chances of having a kidney disease in future. And sometimes what happens is, so there could be end organ damage, particularly the kidneys of that particular donor, the prospective donor would have been affected already. So which can be identified in terms of proteinuria. So if we transplant that kidney into a recipient, the prospective recipient, so that kidney will not take up and will not last long as is expected with a normal kidney. So we don't encourage kidney donation from a diabetic person individual.
Okay. So, doctor, moving on to the next question, can a family member be a donor? Like,
Yes.
can a child donate to his or her father the
Yes.
kidney?
So first option as a donor, we actually try to counsel the family members only. So that is a live related. As per the act, the Organ Transplantation Act is there. So the near relative definition is the first degree relatives, that is the parents, siblings, and the kids also at sometimes. So usually when we say kids, the kids should be more than 18 years of age. Sometimes we do come across certain situations like, the father is a patient, will be somewhere around 50 or 55 years. And the kids, 25 years, 30 years, kids, they come forward for donate the kidney. So, scientifically, it's not contraindicated. It says kids, once they have crossed 18 years and they are mentally and physically fit to donate, there is no hypertension, there is no diabetes, kidneys are functioning good, and he doesn't have any other conditions like cardiac conditions. So scientifically, he can donate. But ethically, or what do you call, emotionally, the father would not like his son to donate kidney to him. So these are the reasons why we see kids usually are not accepted as a donor, but scientifically they can donate the kidney. And most of the time it's a sibling, or they, when it comes to a father donating or parent donating to a child, so that's a common situation we come across. Most of the time it is the parents, mostly mother or the father, donated the kidney, and that's about 50 to 60%. Another 20 to 30% we see the siblings, the brothers or sisters donating. And then the spousal, that wife to husband or husband to wife, it's predominantly wife to husband only. And rarely, around 5% only, we see kids donating to their parents.
Okay. So, if you talk about the major problems that a donor can face, so what are those problems that can be faced by a donor?
Yeah. So when we accept of individual as a donor, as I said, we first thing is we subject him to a checklist, a test. What are the tests? So we see that the donor is safe to donate. One thing is the kidney should work in the recipient when he's donating, and the second thing is he's fit to donate and he is not landing in any other complications after donation. So he should be able to live a normal life with a good quality of life and the full life expectancy, which he is supposed to live without organ donation. So once he's satisfying all these criteria only, we try to clear him as a donor. So this once he is cleared, then there's no, we are sure that in fact he will not develop any complication. Okay. So, but and the studies have shown that because these are a screened population, they are healthy than the normal general population. So they're actually fared well, their life expectancy was good. The chances of getting complications in their life was, considerably less compared to general population. But however, having said this, it is very important for this donor to have their regular checkups done annually and to have a healthy lifestyle. Not that they have donated kidney and they start, having a unhealthy lifestyle, like they're having a junk foods, a lot of salt, a lot of animal proteins, and they're not exercising. They are eating a lot of, the salty food. So that makes them, prone for the complications. So it's very important. They should also have a healthy lifestyle and routine the health checkups done, particularly with respect to the proteinuria, the hypertension, and the creatinine.
So another question we have from our viewer doctor, which is a very important question also. What is a diet plan that should be followed by a kidney transplant patient?
No, when patients are on dialysis, when my patients comes to us at this stage of kidney disease, we have different stages of kidney disease. So we try to restrict the food, particularly the protein, the animal protein, because they progress fast to the end stage. That's called as a climate stage, CKD stage 5. So we try to restrict the protein intake to something like point 0.8 grams per kg body weight, and we try to restrict the fluid intake. We try to restrict the salt intake, and we try to restrict the phosphate dietary intake also. So once patient reaches to a stage of dialysis, that's called end stage in a disease, and patient is already on dialysis. So during dialysis, what happens is whatever the proteins are being washed out, whether it's hemodialysis or keratodialysis. So this is the when we ask the patient to take more protein. So pre-dialysis, we ask the patient to restrict their protein intake, and once this is a reached stage of dialysis, we ask them to take a more protein, something like 1.2 grams per kg body weight. Okay, but however, the restriction in terms of the fluid and salt is the same. They have to restrict their fluid intake, they have to restrict their salt intake, and they have to restrict their phosphate intakes. Only protein we try to increase. After transplantation, of course, they can have a normal diet because their kidney functions are replaced. They'll have a normal urine output, so they can have a normal diet. So that is what is the advantage of a transplantation. They can actually get back to a normal dietary pattern. So they can eat normal proteins. They can eat the normal, even the plenty of fluids. In fact, we ask them to take more fluids. In fact, they normal in a normal individual, we asked 2 to 3 liters. In transplant patient, because they pass more urine, we ask them to take a 4 to 5 liters of the water content. Okay, and they can have a normal protein intake, including the animal and then the plant proteins. And then, of course, salt has to be restricted to 4 to 5 grams per day. And it should be healthy because patients are on immunosuppressions. There's a chances that they get infections, particularly GI infections. So we ask them to be very hygienic so that don't take food from outside. It should be homemade. It should be prepared. It should be eaten when it's hot. So these are the hygienic ways of preparation, food preparation, and healthy dietary habit is important. But they can have whatever they feel like. I mean, they what to call dietary variations can be taken.
So, doctor, how do a person gets to know that his or her kidney is not working well, or they are facing kidney failure?
Yes. So, an important aspect of these kidney diseases is they don't manifest. Like, we have a few kidney diseases like heart, we have breathlessness or chest pain, or we have some GI disturbances, we start having a loose motion, something like that. We have respiratory infection, we have a cough. So we don't have such unique symptoms for the kidney. Most of the time it is silent. Either by the time the patient reaches us, they already have the kidney diseases. Kidneys failed kidney. So this is what is makes a kidney different from the other diseases. But however, there are few symptoms which patients should, individuals should be carefully looking at, particularly oliguria. What we say is oliguria. They pass less amount of urine, okay, and they can have a frothy urine. That is, once there's losing protein in the urine, so it gets frothy like the soap water. And they can have blood in the urine sometimes. They can have a loin pain. They can also, some of the patients, they also say that we have passed stone in the urine. So that is also one of the common system. They actually come with a stone in hand. Okay. So that's one thing. Second thing is like, and they can have a swelling because usually most of the time is urine, the water is passed through urine. Once patient cannot perform urine, they get accumulated in the body, and they complain with the swelling of the body, swelling of the legs, and then gradually distance to the abdomen. And sometimes there's peculiar swelling, like, periorbital around the eyes. They'll have a swelling around the eyes. That's called periorbital edema. So once fluid is, so much that, they affect the lungs, start filling the lungs also, they can have a breathlessness. So these are the few symptoms. But once they get into a stage of end stage renal disease, so it start affecting the every organ. So they can have something like seizures, they can have loss of sensorium, they can have gastrointestinal symptoms like loss of appetite, or they can have loose motion, because all these metabolic waste products which are supposed to be removed by the kidneys, they get accumulated in each and every organ. So our organ starts failing. So that is the stage where the kidney has completely failed. So these are the few symptoms. By most of the time, what happens is they have GI symptoms. They land up in gastroenterology. They don't, come and think that it's a kidney disease and they should approach the something like that. So mostly it is symptoms are not very clear, and often it is no, overlooked by the patients, and they land up in any other departments like gastroenterology, or they can present as simple hypertension, and sometimes the hypertension they consider it's a cardiac problem. They go to consult a cardiologist. They never bother that it's because of the kidney failure they are having a hypertension. So these are the few symptoms which the kidney patients present. And of course, in children, they have a different set of manifestations. Sometimes they can present as simple growth retardation. Okay, growth retardation, they'll have some deformity in the bones. There are certain set of diseases like they manifest as a vitamin D deficiency. So whenever in pediatric age group they are presenting as growth retardation or vitamin D deficiency, they should always look at the underlying kidney disease.
Okay. So, doctor, moving on to the last question for our session, how long does kidney works after kidney transplantation?
Yeah. As I said, because we are taking a kidney from another body and we are putting it in our one another body, so the lifespan is not like the normal individual. The lifespan is limited. Definitely, it will be limited, but young. It also depends upon the donor factors. How good is the kidney? And is it a perfect match? And how is the recipient behaving? So, having said that, a kidney perfect match with a normal donor kidney and the recipient being very compliant with medications, regular follow-ups, the kidney can last for 20 to 25 years on an average. But we have also seen patients who have been surviving for 40 years. And in fact, the first kidney transplantation which happened in the world in 1950, 55, it lasted for 55 years. So we have seen then a maximum survival rate for 50 to 55 years as well, though we say the average being 25 years. Okay, that is for the life. For the deceased donor, it is relatively less because donor is always a compromised. Patient will be in ICU, and patient will be brain death, and a lot of neurohumoral hormonal changes are happening, hemodynamic instability. So definitely that donor, the survival is little less than the life. That is around 10 to 15 years of transplantation. But again, having said that, we have that's an average I'm talking about. But we have seen patients surviving beyond that also. So we have a deceased donor who has been surviving for 20 years after the deceased donor transplantation. But for this, you need to be very, compliant with your medications and your the lifestyle, your dietary pattern, everything.
Thank you so much, Dr. Swarnalatha, for providing us with such great insights over this particular topic. To our viewers, we hope that we have covered all your concerns related to this topic. Librate and GoodMD is also here to convey true and authentic information related to all health-related queries to its users. For further updates, stay connected with Librate GoodMD. Thank you. Thank you so much, Doctor.
Yeah, thank you. And sorry for the inconvenience. In between, there was some problem with my connectivity. Thank you. Thank you very much.